Hello, everyone. Dr. Mariah here, and I am joined by Dr. Cassie Wilder. She is a doctor in naturopathic medicine, and I am just going to let her introduce herself and tell us a little bit more about who she is and what she does.
Yeah, thank you. So I am Dr. Cassie Wilder. I'm a naturopathic doctor, and I also am the owner and I practice at Minneapolis Integrative Medicine Center. We're in Northeast Minneapolis. So being a naturopathic doctor really means that I incorporate a lot of like functional medicine, alternative medicine, holistic medicine, and really kind of blend that in with conventional medicine. So in our schooling program, we did 4 years and we got a lot of the, clinical pharmacology. So knowing how to prescribe and utilize medications to the best of their ability, but also the natural substances. So, say someone needs a blood pressure medication today, we can help, do that piece, or we can, and I don't want to say and we can utilize holistic therapies to help them for the same exact problem. So really blending and being like a beautiful blend of both medicines together. So,
Which is absolutely incredible. I love hearing that. I think we can both agree that sometimes it's great to have a team of medical professionals around you, and not necessarily maybe just one modality. Going off of what you just shared, Dr. Cassie, so would that mean when a patient comes to you for the very first time, you are also taking into consideration, their history and prescriptions that they might already be on, correct?
For sure. Yep. And I would say like the key piece of it, I feel like what makes me like good at what I do or makes like the medicine really work is really the intake and is getting to know someone, because you're asking them questions in such painstaking detail. You're asking if they are coming in with anxiety, you're just really making them go through, how does that feel in your body? When does it get worse? When does it get better? Does it radiate? Does it cause, digestive distress? Like really, how does this manifest in you? And then it's also really important to know, like, what have you tried? Have you tried antidepressants and they didn't work? That might clue us in that it's not necessarily a neurotransmitter imbalance, or that's not the biggest piece of the pie. So I always say like the intake is kind of the piece of the pie or the piece of the equation that's the most important, because you can really get to know what someone's journey has been like and figure out what pieces have been missing and maybe why they're still, maybe they did try therapy and they got 50% better. What's the remaining 50%? Let's figure that out.
Yeah. And where that come from.
And where does that come from?
That's incredible. So you talking about the history, I guess, would you tell us a little bit about maybe what that first appointment looks like? Maybe how long is it? And in your appointments with your patients or anyone that comes to you, I guess you'll probably let us know, but how that just separates, how the naturopathic medicine that you do really separates from maybe someone just going to see their primary care physician in a hospital or clinic elsewhere?
Yeah. Our initial appointment is 90 minutes, so an hour and a half. And I honestly think people need that hour and a half, whether or not it's filled with, productive talking the entire time. I think letting people, air their grievances, like share their story, share their family history, like share what they do for a living and how that impacts them, like just really have the time and space to be able to learn a ton about someone. I really like that 90-minute. I think it's a really key time frame to be uber productive, but also like have a little bit of time to just, get to know someone, kind of like a first date,
I love that. Well, I just want to throw in there what our listeners might not know, of course, is outside of our professional worlds, I see you. I would consider you to be my primary doctor, which I think is really incredible. So I can testify to that first appointment, that 90 minutes. And I mean, you even had questions before I got there in my history, which I thought was really incredible.
Yeah, our intake form, if you printed it out unfinished, like without having anyone fill it in, it's 18 pages. And that may sound really scary to someone, but it does, goes through, have you ever had these types of symptoms? But it really like allows you to sit down before they're even in front of you and say, okay, they've had no respiratory symptoms, like no need to spend a bunch of our time there. It allows you to just be uber focused and figure out what, like, and then also to be able to say like, oh, one time they had, X, Y, and Z. I wonder how that relates to this. And then be able to use that to kind of connect some of the dots.
Sure.
I really like our new patient process. I'm really smitten with it. Mostly because, like I said, like the intake and that initial like getting to know someone and taking a deep history is really the most important part, because someone who is having anxiety, there are thousands of places you could go, gut, neurotransmitters, hormones, you could go into trauma, and you could go so many different directions. And it's easy to read on a blog post like, oh, I want to go through all of these. Maybe you don't have to. You can save money, you can save time by just doing a really deep intake and saying, okay, what are the most like pointed places that I should go? Where can I get the biggest bang for my buck?
Right. So those 18 pages are crucial, you guys.
Crucial.
Right. Well, let me ask you, Dr. Cassie, what are maybe the top few or 3 to 5 conditions that you see in your clinic?
Yeah, I'm gonna lump like cycle period issues into one category because they're all, on a hormonal timeline, but I see a lot of women with cycle issues, PCOS, endometriosis, irregular cycles. I see PMS, I see a lot, the gamut of those, and I really, really enjoy it because there's a lot that natural medicine will do for you that is outside of the conventional world, which can, sometimes with birth control, it's necessary for some people in their lifetime, but most people that really want to heal will seek something different. I really love anxiety. I mentioned that as an example, but it's one of my favorite things to treat. I love treating fatigue and burnout. There's so much that you can do and so many places you can look, and I really enjoy doing that. And I do really like digestion. So I like gas, bloating, variable stools. I think that's all super. It makes for a fun intake too when you're asking someone like, how are you pooping? How's it going? And they're like,
do I need to talk to you about this?
Do I need to tell you this detail? But I like digestion quite a bit too.
Amazing. And with that being said, I know, you shared a little bit, of course, what you see, what you like. Well, tell us about your team. You have a team behind you in your beautiful clinic.
I was fortunate to hire mini-me's. I hired replicas, and they're amazing. They are, we all see similar patient populations and very similar conditions. And I would say that we all have our little like subspecialties that we love too. Dr. Danielle really loves acne, really loves period issues as well. Dr. April really loves fertility. Even patients who are going through IVF or IUI are having difficulty with conceiving, whether they're first or second or multiple child. And so we all have our like little things that we really enjoy, but we take very similar approaches of, taking the good intake, reviewing the labs in a similar fashion, and then doing similar treatment processes such as, dietary recommendations, home recommendations, medicine recommendations, lifestyle recommendations, and really trying to make something comprehensive for someone.
Right. Very collaborative, very
collaborative.
Yeah.
Yeah.
I just love all of that, I guess. Can I ask you before I forget, would you tell us a little bit about your story and how you found naturopathic medicine? Like what brought you to where you are?
Yeah, actually very interesting you asked that because I wanted to be an MD my entire life. I've always wanted to be a doctor. And I did a small rotation, maybe 8 months with a gastroenterologist when I was at Iowa State in my undergrad, and really knocked medicine off the pedestal for me. Like I really had this like big idea of what doctors did for our patients and, really how we treated them. And I just really had this elevated view of MDs. And when I was with him, I felt like, well, why didn't we ask that person with intense, stomach pain, what they were eating? Like, why do we always just have to go to scopes, or why do we always have to do procedures? Why can't we, ask them more questions? And his answer to me literally was, asking about the diet is the dietitian's job. Asking, that was like the biggest thing that stood out for me. And they were like, this patient's lab's fine, her scope's clean, there's nothing wrong with her. And I was like, oh, okay. Like that's not necessarily the doctor I see myself being. So It really knocked medicine off that pedestal for me. So I withdrew all my applications, withdrew my interviews to med school. And I moved in with my boyfriend, now husband, yes. But I moved with my boyfriend, and I worked for a chiropractor. So I worked for a chiropractor for 8 months. I know. And as a part of her practice, she did nutrition consultations. Okay. And they sent me to a conference because she was pregnant with one of their children. She sent me to a conference on biomedical nutrition. And it talked all about like the methylation cycle and utilizing vitamins to push pathways and utilizing nutrition to heal like autoimmune disorder. It was the coolest thing I had ever experienced in my entire like career so far. And I came back from that conference. I essentially like stalked that person, like, who are you? What do you do? How do I be you? And turns out she was a naturopathic doctor who gave the talk, and got in touch with her. She told me all about what she did. And then I went off to school. Actually, within 2 months of going to that conference, I had already had all my prereqs in. They got me in for a late interview cycle, and like I had everything, like all my boxes were already checked. And they were like, "Well, if you want to start in January, you can." And like I just was like, I can't not. Like this is when it's something just like lights you up that much, you just have to go. And I did, and here I am.
Okay, absolutely incredible. Thank you for sharing. I've had to ask.
Yep.
Well, Dr. Cassie, this has been amazing. I do not want to steal too much more of your time, but I do want to ask you, maybe for any of our listeners and whoever finds this video, our little chat here, what would you say to someone that might be on the fence? They don't know, maybe they're afraid because insurance doesn't cover, and they just don't know what to do. They need maybe a next step. What would you say to someone that might be considering your services, your expertise?
Yeah, I would say that women are the most intuitive beings that I know. Like women have this like incredible intuition to where if they have this light inside of them that is drawing them towards something, they should really listen to it. And so I have there's a lot of patients who have concerns about like the insurance not covering it. And what is it going to be like? Maybe you've helped other people, but you haven't, can you even help me? Am I able to be helped? And I usually go back to, I don't want to say stalk them, but find podcasts that they've been on, find blog posts that they've written, like really with any, doctor outside the system person that you want to work with, like really do your due diligence and finding what they have written. It'll tell you a lot about where their brain space is, what they think about, how they think about things, and then trust your intuition. Do you vibe with this person? Do you like what they have to say? Do you like the sound of their voice? Like, do you even how do you vibe with this person? Yes or no? And if you do, just like trust that intuition that A, you deserve to be helped. B, no one is unfixable. And then C, you just have to find that right person. And if it's not me, there are many people out there, and just like trusting your intuition that you're in the right space, because honestly, believing that something can be, believing that it's like a Disney quote of, I'm like stumbling with it.
Oh, and I'm sorry.
This is the pregnancy brain part of me, but like, believing is the best, like believing is like half the battle. Like if you don't believe that something will, work out well, it probably won't. And so you just making sure that like, you know what I'm talking about?
Whether you believe you can or you cannot, you are always correct, or something.
Yes.
There's something along that line.
There you go. I'm like, I feel like it's a Disney quote.
You are always correct. Yeah. We'll Google it after this.
We'll Google that later. But that's someone who's really on the fence is just like, trust your intuition, because women are incredibly intuitive and they're generally always right, which is incredible.
Spot on.
Yeah.
I love that. Okay. Well, last but not least, will you please tell us how we can find you?
Yeah. So I spill all my brain space on Instagram. So we utilize Instagram for just education purposes. We have a weekly blog that goes out that then pushes to Instagram. So it is MPLS as in Minneapolis, Integrative MC as in Medicine Center. So MPLS Integrative MC is our handle. And I have a professional Instagram that I just am too busy to use. So I dump all my energy and my brain space into our clinic Instagram. And we just use it as our, soapbox to preach that there's another way. And I love that the platform is free for, is it free for everyone? But yes, it's
at this point, so far.
At this point it is. So far, so good.
Amazing. Well, I just need to say thank you so much for your time. This was incredible.